wick that runs from the sebaceous gland and feeds sebum up to the surface level of the skin. Acne is an inflammatory infection of the hair follicle and the associated sebaceous glands. It occurs within the pore, when the pores get clogged with sebum and dead skin cells. And although acne is common amongst teenagers, it also affects people of all ages, men and women, and in all areas of the body where there's a sebaceous gland. There's a variety of causes, including genetics, fluctuating hormone levels, stress is a big one, high humidity, and then using oily or greasy personal care products can also cause clogged pores. There are some conditions that are considered contagious, however, acne is not one of them, but it can be spread from one pore to another if proper hygienic techniques are not used when extracting or if a rupture occurs. So clogged pores are known as comedones. They cause oily skin and several types of lesions, such as whiteheads, blackheads, and cystic acne. A whitehead is a type of acne that forms when dead skin cell sebum and some type of pathogen, normally bacteria, but it can be others, become trapped and they clog your pores. Its characteristics are pale or white head. It's a pustule, on the skin. It can be confused with milia, and milia is a hard white bump. It looks like a whitehead, but the contents are actually a keratin protein. It's just like fingernail contents, and so you basically have fingernails growing out of your pores, which is kind of cool. A blackhead is a clogged pore in which the contents have oxidized. So the best way to explain it is if you've bitten into an apple, forgot about it, let it sit there, you come back and you find it and it starts turning brown. But if a day or two goes by and you go find that apple that you left, it could be black and very hard, and that process is called oxidation, and that's what's happening when you have a blackhead on your face. Cystic acne is the most serious type of acne. It is extremely painful to most patients. It forms deep within the skin. It's normally red and inflamed. It's seen with people that have hormone imbalances primarily, but lately we've seen it a lot because people are wearing masks. The respiration and toxins that are coming out on the exhalation are actually clogging the pores, and they're deep and very, very, very painful. So that's what cystic acne is. So there is no known cure for acne. However, there are several treatments that are available to it. Some people believe that diet plays an important role. I happen to be one of those people. Some foods that are high in phytochemicals called carotenoid are very helpful for this skin condition. That's your yellow and your orange fruits and vegetables. And your dark green leafy vegetables are important too. They recommend that you eat foods high in omega-3 fatty acids, as well as high glycemic foods. And unfortunately, Mr. Craven, if you have acne, you need to really eliminate dairy from your diet because it has a very, very high hormone level in it. It's partly because we're injecting it into our food, but it has high levels of estrogen in it. So they recommend that you take it out to balance your hormones if you're having skin conditions like acne. So I recommend a topical solution too. It can be made in your home. There's 2/3 part baking massage, though, is a local contraindication in that area for acne. It can be painful to massage people with acne, and it can also rupture and spread and contaminate other pores, so it just kind of makes the whole condition worse. It can also cause scarring on the client if you rupture it during a massage. So this concludes my presentation on on acne. Sorry if I digressed a bit. It's kind of skin's kind of my thing with nutrition.
You're in the right place. Yeah, I love that. Thank you. Yeah, fantastic stuff. Thank you, thank you, thank you. That was really well done. And just remember, local contraindication means they can get a massage, just don't rub that area, right?
Well, and it's recommended that you can work around that area, bring blood flow to the area.
Sure.
We can do some manipulation to it, but heavy compression is not recommended at all.
Yeah. And by the way, not a huge concern, period. Like, you're not going to kill somebody, but she's right. You can actually spread the bacteria that's causing the acne and make it worse. That's one of the big concerns. That's a local contraindication. Thank you, ma'am. I like the shout out to the diet too. Yeah.
Take care.
Thank you, ma'am. Miss Carrillo, athlete's foot. That's a fun one.
First off, Ms. Pablo, you were so smart. Oh my gosh.
It was very well explained. I loved it's like an apple when it oxidizes. Yeah, excellent.
Yeah, that's crazy. So I want to present my tablet screen. I have something set up.
You can.
I have to. No. I in the Google Hangout. So hopefully it works. Let me see if it works.
Yeah, you should all be able to present on this thing. So let's try it. Here it comes. Let's see.
Hold on.
Yeah, take your time. This is actually. You are presenting. It's coming through.
Okay.
We've got it now. Yeah.
Okay, awesome. So I want to make a few disclaimers. I had to use some photos from the internet,
That's
and
fine.
also some names and likeliness. It's just all coincidence. So, what is athlete's foot? So, athlete's foot, aka tinea pedis, is a fungal infection of the foot. Fungi is a fungi of dermatophytes, and you can usually find it in the sole and between your toesies. It's usually in teenagers, like, oh my God, and adult males. You can also, it can also really affect the weakened and impaired immune responses. And an example of that is diabetes. Oh, my hands are shaking.
It's okay. It's okay. You're doing great. You're doing great. It's a lot of pressure, but
This
you're doing great.
condition, thank you. This condition is more common in warm and humid climates. So, like when you are an athlete and you have your socks on, it gets really humid in there, you know. So it's really your feet sweat and the humidity, and also we're in Arizona especially, so and it makes it really stinky. So a lot of fungus gets really stuck in there. All right. So how do we recognize athlete's foot? Well, let me get it. It's mainly between your toes. You can you can find it between your toes, and it's sometimes itchy. So you'll get some. Excuse me. You'll get some itchiness. Cancel. Sorry. You'll get some itchiness like between here, especially here, and you can find it at the rim of your foot, like right here, or right there. And it can also be on top of your foot, like here. And you can get dry, flaky skin, which there can be also here and also at the bottom of your foot, as seen here. And there's also some blisters, and these are the most aggressive. These are the ones you have to be careful because they could really contaminate your linens and get on you. But yeah, they're mostly like at the bottom and on top. Okay. So, can we massage it still? What you must do is avoid direct contact. You cannot touch it with your bare skin. It is not recommended. Definitely, it'll spread. So here are some things we could do. So athlete's foot is contagious. So what you can do is use disposable gloves, like this gentleman here. He's got his gloves on, and then, or you can use a sheet drape, which this gentleman right here is so lovely getting ready for, getting ready to drape the foot. Fungal infections don't spread easily by linens, but you have to treat all the linens in contact as contaminated. And as a little bonus, I asked some random people. I went into a random group chat and I asked them how would they feel if they couldn't massage feet anymore. So here is some feedback about massaging feet. Depends on the foot. It says someone named Sab. Me, ha ha ha, man's after being asked who hates touching feet. I think they were confused. I think they thought I said love touching feet. So, it's okay. It's okay. I still had to put it as is. And did you ask that question just to say that? Osuna, referring to the brilliant pun I made. And bruh, said someone named Sab. Okay. All right, and that's the end. Thank you very much. This is my presentation. Welcome to my TED Talk.
Wow. Okay. Wow. Thank you. There we go. That was really well done. You guys are you're gonna put me out of a job. And by the way, do not feel bad if you don't have visuals and fireworks to everybody. Like that was fantastic. But both those presentations that you've seen so far were over the top, and I'm wonderfully over the top. Please continue if you want to. I just don't want everybody to feel like that was fantastic. It was funny. It was memorable. It was all that stuff. Just to kind of add a little experiential caveat with that too. I 100% agree with everything she said. By the way, this is why we wash our hands. By the way, because somebody can have mild athlete's foot and you wouldn't even know though. And it's why we always wash all of our sheets in hot water and something like bleach, because we don't know actually. And just so you guys don't freak out, as long as you're washing your hands and washing your sheets and stuff, I've actually never known a massage therapist to actually contract athlete's foot from a client. So that's the good news. But if you are aware they have it, yes, what we do is massage them through the sheet. That's a really common thing to do. And gloving up's fine too. I just tend to not glove up because it makes people feel like, I don't know. So I'll massage them through the sheet or something. Yeah, that was fantastic. Thank you. Thank you.
I also want to say, like, I just love art. I used to be an artist.
I can
so
tell.
nice. So when we got to do a presentation, I was like, oh my gosh, I want to draw. I was going to draw a foot, and I never drew a foot.
That was good.
Thank you, everyone.
It was really good. Thank you. It was fun. Really well done. Miss Clayton, you're going to tell us about boils.
Yeah. I also have a presentation, although it's not as fun and exciting and creative.
Neither are any of mine, so don't feel bad. Yeah.
Do I just go?
Oh, if you want us to see your presentation, at the bottom of your screen is probably something that allows you to present the presentation. On mine, it looks like a square with an up arrow in it. And once you click it, you then have to select the window. You have to select where you want to pick it from. And it will say something like window or tab or whatever. And then you have to actually get that thing. And so right now, we are seeing your entire screen. So you might want to get out and go back in and tell it that you want to, I go out and I pick that again. I tell it you want to pick a window based on what I just saw, and then pick the picture of that window that you want. What you did was share the entire computer, which sometimes we do. There's nothing wrong with it. There you go. Now we are seeing this, and now if you present it as a slide presentation, yep, start from the beginning, we should be good. Yeah. Wow. We definitely see that.
Okay. So, boils.
Yes.
Similar to what Miss Avalos was saying, a boil is just really acne gone bad. They're relatively common, just like acne is. It's a deeply infected hair follicle. So acne is infected hair follicle. A boil is really just acne that's gone really bad and very infected. It's painful. It's similar to cystic acne, um, but there's the bacteria in it, and it's usually pus, and it can be anywhere, but it's most likely where acne is found. So face, neck, armpits, back, buttocks, thigh, and shoulder. So the common places that you're likely to find acne is where you would also find boils. Anyone can get a boil, but some are more likely to develop boils. Similarly, anytime you have suppressed immunity or you're immunocompromised, this is more likely to occur because your body can't fight the bacterial infection as well as it could if you didn't have those um, problems. Diabetics usually are always referenced because they have suppressed immunity, but they also have an excess of sugar, and that's what bacteria eat. So they have an additional food supply. Poor hygiene. So a lot of times, if you're not, bathing regularly or using soap, things like that, if there's higher bacterial content on your skin, that puts you at a greater risk there. And then anyone who has exposure to chemicals that can irritate or harm your skin, because the way that acne and boils develop is the bacteria gets in through a small nick or cut or lesion um, that then allows that bacteria to thrive and grow. So in terms of the cause, like I just said, there's some type of opening that allows that bacteria to get in and travel down to the hair follicle, and then it gets infected. So most of the time it's the staph bacteria, but it can be caused by other things too, such as fungus or bacteria that are a lot more destructive, such as MRSA. Some boils will go away on their own, but most of the time an antibiotic will be needed, especially if you're immunocompromised and your body isn't as capable as fighting those infections. The symptoms similar to acne, the skin around the boil becomes infected and appears red, warm. That's supposed to say swollen and painful. Depending on this prevalence of the infection, it may cause a fever, and your lymph nodes may also swell. The picture there is called a carbuncle. It's multiple boils in the same area, and that's definitely going to require antibiotics to get rid of that one. And in terms of what you need to know as a massage therapist, they're a local contradiction similar to acne. The boil, oopsie, oh, that's weird. I don't know what's going on right now. The boil does contain bacteria. This is really, I'm not sure what.
Use your back arrow. Oh, okay. You're doing fine.
That was weird. Because I'm not touching anything on my computer. The
There we go. You're doing great.
So area of the boil does contain bacteria. What is going on? Don't touch they do say consider wearing gloves. It depends on, what you want to do. And then the fun facts are a boil in your eye is called a sty. And how do you spell sty? I guess it doesn't like the way that's spelled. And then to help minimize boils, they recommend taking supplements of C and D, and then topical supplements. So if you have any creams or lotions that have vitamin A, which is retinol, and then vitamin E also help fight boils.
Excellent. Good.
That is it.
That's perfect, Miss Clayton. That's perfect. Yeah. So, well done, by the way. Don't worry about the technical difficulties. That's what we're learning to do is present. Yeah, boils are a local contraindication. I don't even glove up when I see them. But again, remember, I'm really casual. But I just work around them. Yeah. Yeah. And you will.
Did I stop sharing or do you still?
No, you stop sharing. You're good.
Okay, good.
We're back to normal. Good job. Thank you, ma'am.
Sure.
Excellent. Okay, Mr. Craven, you're going to tell us about bruises, sir.
Oh boy, this is a hard act to follow. Y'all did really, really well. Crazy. Mine's gonna be a little different style. I have mine written down on a notepad.
That's totally fine, Mr. Craven.
All right.
Yeah.
All right.
You didn't make a short film or anything like that, huh?
No, that'll be the next time.
Yeah, of course. Yeah.
All right. So we've all been there. You've opened to a bedpost, forget about it. Then about a day later, you have your own surprise custom piece of art.
That's true.
Talking about bruises, people. What really happened though is that there was enough blunt force to cause damage to the blood vessels without rupturing the top layer of the epidermis. Then that blood leaks out and collects inside the interstitial spaces of the dermis, resulting in the typical black and blue design seen on the epidermis, which is the skin, right? This can be witnessed on almost any part of the epidermis, and you should treat it as a local contraindication when in this state. When a bruise heals, that black and blue blood is absorbed back in the skin and will usually turn a greenish color within less than a week. So once you notice this healing process, you should leave the decision up to the client whether or not to massage the area. Some people might want it, some people might not, so it's just better to ask, right? That's pretty much it, but I'll give you guys a couple lessons too.
Oh, sure. Go ahead.
The history buffs out there, this word bruises originated around the year 900. In the Middle Old English, it was also known as brucin, bressin, bryson, or brucin. But that one just has a U, not the two O's. But if there is one main thing that you guys should take away from this presentation, it would be that, if you have friends and family that are eager to learn about what we're doing in class, just give them a little interactive demonstration about the pathology of bruise creation. Just no face shots.
Right. Well done. Thank you. Thank you, Mr. Craven. By the way, that's an excellent example, by the way. I'm not, we now know what bruises are. And we also know it's a local contraindication. I really mean that, sir. And you were prepared. I'm just asking people to prepare and not stand up there and read something out of something. That was excellent. We now know that bruises are a local contraindication. You just work around them. I want to add a little massage therapist tip for you. And he is right. They can be massaged when they're in the healing stage. And to make it even simpler for you, they can be massaged anytime it doesn't hurt the client. You don't have to even figure out what's going on. If it doesn't hurt the client, it can be massaged. But here's the little massage therapist tip that's really, really helpful. When you find a bruise on, let's say, somebody's back or the back of their legs, a place where you're pretty sure they've never seen it, or even a place where you think they might not have seen it. Let's say it's a tiny little bruise, and you're not even worried about avoiding it. You don't even care. Like, I don't actually care when I see a bruise, to be honest with you. A single bruise. People have bruises everywhere. I'm sure you've noticed some of your classmates. People bruise all the time. Could care less. But when I'm working on the client, I go, oh, does this bruise hurt? And they say, they usually say, no, I didn't even know it was there. Oh, okay. And I just keep working. Why did I do that? Because it's not because I actually, yes, Miss Rader.
case it's something to be concerned about, you kind of let them know, so it's up to them at this point to get it checked out or not.
Yes, that's a really good point, right? Let them know about it, absolutely. Really good point, because they might not even know it's there. That's true. Mr. Bose?
Oh yeah, that's exactly what I was about to say. So
Okay.
later on when they see it, they don't try to blame you for it.
Well, that's a little bit different what you just said, and that's why I said it, yeah. So Ms. Rader's saying, let them know because it might be something they need to get checked out, and she's absolutely right. But Mr. Bose is saying exactly that. If you don't do that, what happens is they go home and their spouse all of a sudden, for the first time ever, notices the bruise, and they think you did it. And we've had that happen at the Princess a lot. Like, I'm used to getting complaints, so I kind of know what the most common complaints are. And the therapist is like, that bruise was there. So it's just a very clever way to let them know, like, oh, does this bruise hurt? So that when their spouse sees it later or whatever, they'll be like, oh yeah, the massage therapist noticed that, not gave it to me. Just a little way to cover yourself. But Ms. Rader, you're right, by the way. You should let people know stuff that you see on their body that you're pretty sure they haven't seen, because people don't get to look at the back of their body. And even their spouse doesn't really kind of like scan them like we do, right? Well said. Thank you, sir. Well done. Truly. Really well done. Okay. Miss Dang.
Hello.
Hello, Miss Dang.
Yes.
We can hear you.
Yes. Burn is a type of injury to skin or other tissue, and injury causing damage to the epidermis, hypodermis, or organ underneath. And burn can be caused by heat sources, including superheated air, liquid, and solid. Cold radiation, including sunlight exposure, and radiation therapist. Chemical agent, electricity, or friction. There are 4 degrees of burns based on the depth of tissue damage. First degree burns, also called superficial partial thickness burn, damage only the epidermis, like sunburn. Second-degree burns, also called deep partial thickness burn, is deeper and more severe
Severe.
than first-degree burns, and involved both of epidermis and super layers of the dermis. After the burn heals, a scar may remain. A third-degree burns, also called a full-thickness burn, destroys the epidermis, dermis, hair follicles, and possibly extends into the soft tissue. A fourth-degree burn is a full-thickness burn that extends down to the muscle or bone, and avoid massage even the burnt area until it has complete healed. Healing can range from 70 days to 70 months. Before massage the affected area, it asks the customer, and the lady said, if she said, they say, okay, so you need judge the pressure for the area, for the affected area.
Excellent.
Thank you.
Thank you, Miss Dang. Thank you. That was excellent.
I understand my English
We did. I'm going to summarize some stuff you said, but I actually understood everything you said. I also, I think many people out there are extremely nervous to do this, and if I had to do it in a language that wasn't my own, I'm very impressed. Thank you, Ms. Dang.
Thank you.
Thank you. So, burns are a local contraindication. Ms. Deng told us this, by the way. I'm just summarizing. Ms. Deng told us burns are a local contraindication. That makes sense, right? But what's kind of cool is you guys now know about the layers of skin and the degree, and she said all this, the degrees of burns are basically what layer of skin it gets through. So a first degree burn only got through the epidermis. A second degree burn is getting through the dermis. A third degree burn is getting through the hypodermis. And by the way, people argue a little bit about this, but this is pretty darn accurate. A fourth degree burn has gotten through all the skin and is now down into the muscles and organs and stuff below. So, you know, some burns are usually a first degree burn, right? They're just kind of hitting the dermis. They can get to a second degree. But anyway, so it just gives you an idea of how to remember that. First degree is first layer, second degree is second layer, third degree is third layer, fourth degree is very, very, very bad because you've eliminated all skin. Very cool. Local contraindication. Thank you, Ms. Deng. Nicely done. Okay. Ms. Dimitrik. Ms. Dimitrik, you're going to tell us about cold sores.
Okay, I have a PowerPoint as well. And
I love it.
Window.
Yeah, if it's in a window, you click the window, and then you click a picture of the thing you want.
Okay.
And it looks like you did it. We're going to see. Hold on. We have a black window.
That's not what I wanted to share.
Okay, then unshare and go back and try again, because this is good.
Window.
And everybody, we're going to take a break after Ms. Dimitrik's presentation.
Is it sharing?
It is sharing. So now we have your cold sores and fever blister presentation just presented as a slideshow, and I think we'll be good.
All right, I'm hitting that button. There goes.
There we go. We're
Okay.
on.
Cold sores and fever blisters. What is a cold sore or fever blister? A cold sore is a recurrent viral infection affecting the skin and mucous membranes. Cold sores are also called herpes simplex and fever blisters. So cold sore and fever blister are the same. Cold sores can appear anywhere on the body, but most are around the mouth. And cold sores are a very common disease. Lesions tend to recur because the virus lies dormant in the sensory nerve cells that correspond to the site of the infection. The reactivation of the virus can be triggered by sunlight, wind, presence of another infection, such as a cold or fever, hormonal changes, stress, anxiety, or chapped lips. And most people in the United States are infected by the virus by age 20. There are 4 stages typically of a cold sore outbreak. So the first stage, which takes 1 to 2 days, is a tingling stage. The prodromal symptoms include pain, burning, itching, or tingling at the site where the blister forms. For 2 to 3 days, you have your eczema stage, where the skin is red and raised due to inflammation. There is a blister ulcer stage that lasts 3 to 4 days, where the blister is filled with the viral-laden fluid. From rupture till crust, this is the high risk of spreading the virus time. And then for 5 to 8 days, healing occurs, and scabbing occurs, and the redness resides. Okay. Now, how do you get a cold sore? Well, here's a story about Mrs. Jones, a young college co-ed, and her first kegger party at a fraternity house. Her first weekend in college, she and her roommates went to the fraternity party. Mrs. Jones started to drink lots of beer. She drank beer from her cup and beer from a quarters glass that dozens of strangers were drinking from, and beer from the beer bong, again shared by dozens of partygoers. The lighting was dim at the party, but from across the bar, Mrs. Jones saw a handsome upperclassman. Their eyes met, and it meant something. Here is what Mrs. Jones did see until that dim light, after she spent about 10 minutes with her mouth pressed against his in all its wonder. Now, it could have been a kiss, or it could have been the quarters glass, or the beer bong, or maybe her roommate's towel she used to wipe her mouth with after throwing up from drinking all that beer. But 2 days later, Mrs. Jones got a painful tingling on her upper lip, the first sign of a cold sore. So cold sores are spread by contact with infected skin or contaminated items. So what does a cold sore mean to a massage therapist? The area should be avoided during the massage, as cold sores are contagious, although healthcare associated transmissions are rare. Standard precautions should be followed to avoid contamination. Practice hand hygiene by washing hands before and after working with the client. Disinfect contaminated linens, surfaces, and massage instruments. And use personal protective equipment such as disposable gloves when contact precautions are required. Cold sores may also be found in the genital area, but this area itself is off limits to a licensed massage therapist, so should not create an issue in the available areas to massage.
Oh, oh my God. Snide remarks. Oh, Miss
Thank
Dimitri.
you.
Oh my God. That was really good. Wow. Oh, I don't even know what to say. It was excellent. Thank you. Local contraindication, well done. Funny, true, PG, rated R. I don't know, it was right in the middle there. I didn't know where we were going to go there for a minute. It was fantastic, Mr. Dimitri. I loved it. Thank you. Yeah, guys, with all these skin conditions, pretty much, but Mr. Dimitri said this, but just to remind you so you guys aren't freaked out to ever touch people again, it is very, very unusual for a practitioner to actually catch this stuff. If you don't rub it, you're fine. And believe it or not, even if you rub it, if you wash your hands afterwards, you're fine. The problem is when you touch this stuff and don't wash your hands and then touch your face, right? So you are very safe. You don't see a whole bunch of massage therapists walking around with cold sores that they got from other people. But you are exactly right. Thank you, Ms. Dimitri. Well done. Let's take a 15-minute break, well-deserved break. We will be back at 9:48. Back. Okay. Oh my gosh, it's been a great day. All right. Mr. Bose, you are up next. You're going to tell us about Decubitus Ulcers, and I am looking forward to this. Thank you.
It's so nasty, but okay. What? Okay, hold on. I have a presentation too.
Oh my gosh, all right. You go. Take it down.
Oh dang, hold on. I just said. Okay. Share my screen.
Yep. Okay. So.
Can you see it?
Yeah, I think we can. I think yes, we can.
Okay, so I have the Decubitus ulcer.
Yes, you do.
Hold on, I'm trying to see if I can present this in a better way. Oh, there we go. Play.
There you go.
Okay,
Cool.
so a Decubitus ulcer is also referred to as a bed sore or the pressure sore. So it's most common in people that are in nursing homes or people that have been hospitalized for long periods of time and they're constantly laying down. Um, it's an injury to the skin and underlying tissue from prolonged pressure on the skin, and they're more likely to occur in areas of the body that are more bony, so like the heels, ankles, hips, and tailbone. So there's, when I was research, it said that there could be up to 6 different stages, but there's most commonly only 4. So we're going to go through those stages right now. So stage 1, I don't know if you can see, but this is like somebody's heel right here. So the skin is still intact. It's non-blanchable, which basically means like if you were to push on it, it would turn white. Like you would be able to notice that like there's blood flow in there. There's a lot of redness. There's darkly pigmented skin. May not have that same blanching ability, but the color probably will be different in the infected area. And then stage 2, so the partial thickness, loss of dermis. So now there's like a shallow opening. You can kind of see more where the area is infected. Sometimes it could be red or pink. And there also might be a little bit of pus coming out of the blister as well. So then stage 3, that's when we have full thickness tissue loss. So some fat may be visible, but your bone, tendon, and muscles still aren't exposed. And then there may be some type of tissue loss in stage 3. And stage 4, so at that point you can see exposed tendon and tissue or muscle. And it's extremely painful. And once you get to stage 4, if it's not treated, like this can actually be extremely fatal. And then they also have, it's so weird to do this on my phone.
It's going pretty good.
Okay, there we go. So I also did the treatment factors, so how you treat a stage 1. This one is the most mild stage, and it's not necessarily reversible, but you can definitely like save that part of the body a lot quicker if you were in any of the other stages. So basically what you're going to be feeling is pain, burning, and itching. That spot will feel different from the rest of the skin. It could be firmer, softer, warmer. You'll definitely notice like the redness in that area. And like I said, if you have darker skin, then it just may be discolored, but you might not really be able to tell. And then if, like I said before, if it doesn't get light when you press on it, or even 10 to 30 minutes after you stop pressing, that means that there's less blood going to that area. So what you want to do is you want to change the position that you're on. In stage 1, you want to make sure you're not applying pressure to that area anymore if you notice these symptoms. You want to try to move at least every 2 hours. If you spend a lot of time in bed, move every 15 minutes if you're constantly sitting. You definitely want to make sure you're washing it with mild soap and water and dry it gently. And I also found that if you eat a diet that's high in protein with lots of vitamin A and vitamin C and iron and zinc, and drinking a lot of water can also help reverse the stage 1 symptoms. And then for stage 2 pressure ulcers, it's very similar to treating stage 1, but you're going to want to make sure you seek out medical attention at this point, because there's probably a little bit of an open wound, and you want to make sure that you use some sterile saltwater solution to dry out the wound, and you're again still going to be experiencing that pain and stinging. Stage 3, you need to seek immediate medical treatment. These sores need special attention. You have to get a certain antibiotic for it. And at that point, there will be some dead tissue, so that dead tissue needs to be removed in order to start the healing process and to prevent or treat the infection. If you're immobilized, your doctor may recommend like a certain mattress for you to sleep on, or a bed to relieve the pressure from the infected areas. And then at stage 3, it takes at least 1 to 4 months to heal. And then stage 4 pressure ulcers, you need to be taken to the hospital immediately. Your doctor will most likely have to recommend surgery, and then recovery for this ulcer can take anywhere from 3 months to 2 years to completely heal. And again, if it's left untreated, it can be fatal. are the lovely ulcers.
Yeah, those are bad ones.
So you have on the left, well, it's my left side of the screen. You have like stage one. You see where there's like a little bit of redness up on their butt, and then stage two, you see a little bit more of an open wound here, but it's a lot more red than stage one was, but it's not as open as stage three, and it's not as open as 4 or 5. Um, when you get to like stage four right here, you're going to see some of the tissue start turning black. That's because it's dead at that point. That's why it has to be removed. That is one of the pressure ulcers right here. Ugh, that's so nasty. Hold on. Okay, next. I don't want to look at this anymore. One second. There you go. Okay, so how does this relate to massage? So upon my research, it doesn't really say whether massage helps these ulcers or really hurts these ulcers, but you definitely want to make sure you're avoiding that infected area, regardless of if there's a bandage on it. You need to be very careful with whatever you're massaging with so it doesn't get in that ulcer. Um, they do recommend, because it improves blood flow, like the massage does, that you get at least 15-minute daily sessions, but you don't want to be overly vigorous to get their blood flowing, and you don't want to do any deep pressure. And I don't know how to pronounce it. The decubital ulcers are considered a local contraindication.
Yep.
I think that's how you say it. Yeah, and then some of the benefits that the massage can give to people with this type of skin condition is it can increase the blood in the area, improve tissue suppleness, reduce any type of swelling, and it can also boost the immune system.
Excellent. Excellent. So everybody, we're starting to see a pattern here, right? The pattern is if it's open, don't touch it, right? So you don't have to worry if somebody's got a stage one, you might not even know. And massage probably even helps that stuff because you're getting blood flow back to it. But when there is, and by the way, you'll never see stage 2, 3, or 4 on your table. You just won't. But anyway, if there's an opening in the skin, it's automatically a local contraindication. Doesn't matter if it's a cut, burn, ulcer, whatever, right? Thank you very much, Mr. Bose. Well done.
You're welcome.
Thank you. It was good. Miss Everson, you're going to tell us about eczema, and I can't wait.
So, all right. So eczema. Eczema is a skin inflammatory condition, and it's not contagious.
Right.
Basically, identifying it, it is a pink to reddish in color, and it can have the consistency of a scab, depending on how bad it is. But usually it's not that bad. And in certain cases, it can be found like in between the folds of your hands, the folds of your elbows, the folds of your knees, could be on your neck, just the more sensitive areas of the body. This is not affected by massage. In fact, massage does help the areas. It brings in more blood flow and stimulation, and it also lowers the stress in your body. And so, I couldn't think of the word of it, but it lowers the stress in your body, so that actually helps with the immune system and helps fight that skin condition. It is between 25 and 30% in children. It can be found, and mostly in children before the age of 5, but adults do have it as well. And if they do have it, it's usually an autoimmune problem as well, or a potential allergic reaction. And most of the time, it is hereditary in adults. If they are exhibiting eczema as an adult, it usually means that their family members or someone in their family has eczema as well. So it can be passed down. It is not contagious, is what I said before. And massage the area. It is itchy for them, and they could be self-conscious of their eczema, so it's best to get verbal consent to ask your client if you can rub those areas. It's not going to affect the area unless it's a more severe case, because it can blister off kind of like a scab. That would be the more severe case. Otherwise, it's really not going to do anything by massaging it or rubbing it. If anything, it'll just help. It doesn't spread at all. So it's a local contradiction. Local contradiction.
Yeah, I love that. Cool.
Yeah, and things to prevent when you do have a client with eczema, use a hypoallergenic oil. A lot of the oils and whatnot can actually make them worse, as well as essential oils. There's a lot of essential oils that actually make that condition worse. So you kind of just stay away from those, and potentially let them know, because they may not be important.
Well done. Thank you, man. Thank you. Yeah, I'm glad you brought up the emotional factor. So, guys, you will get clients with eczema. Probably some of you have eczema. It's super common, and it's not contagious. I know you said that twice, but I want to say it a third time. It's not contagious. If it's not scabbed, or it doesn't look like it's going to, bleed or something like that, you can massage it if the client's okay with it. People are going to come to you, by the way, do not feel like you have to be the expert. You are not doctors. The clients that come to you usually 99% of the time know more about their condition than you do. 99% of the time. And they'll be like, oh yeah, it's my eczema. It actually feels good when you massage it. If you're okay with it, I'm okay with it. They'll talk to you that way. Or, yeah, it bothers me when it gets massaged. Don't massage it. Fine. Now, by the way, if it looks like it's bleeding or whatever, or it's going to bleed, you leave it alone. But it's completely up to them. You just ask for their advice. Don't be afraid to talk to them. Even weird stuff, people are usually very comfortable talking about their condition. The other thing is a little Tapscott trick. Everything I see all the time. Here's what I mean by that. When a client, goes, oh, I've got this, it's really gross, I've got this eczema here, I go, yeah, I see that all the time. That's basically true, but I want them to know it's normal. You'd be surprised how many people have, don't answer this out loud, but how many people have you seen naked in your life? It's not that many people. I've seen 15,000 people basically naked. I have a much better idea of what's normal than most people do. And so they've got a sixth toe. I've seen that quite a few times. Oh, I see it all the time, right? Oh, that's eczema. I see it all the time. Oh, that's a giant boil. I see it all the time. Because the biggest problem with all this stuff is, yeah, you don't rub it. Duh. It's an open wound. I don't rub it. The biggest problem is them psychologically. Remember how you guys felt on the first day of class? Like, by the time you graduate, you're going to be like, oh, yeah, whatever. Start rubbing. You'll be taking your clothes off and walking down the hallway, right? We get very comfortable with that as massage therapists, but don't forget how you felt the first day. That's how clients feel. They feel too fat, too skinny, too bony, too not bony, too hairy, too dry skin, extra toe, that finger's too short, I know I'm weird, all that kind of stuff, and everything is like, oh, I see that all the time. I've learned to actually not let your arm could fall off in front of me. I'd be like, oh, I see that all the time. Like, I do not react, because that's the biggest problem, right? So that's really good advice. I'm glad you brought that up, Ms. Everson. Thank you. Thank you. Okay, moving right along. Miss Eversole, you're going to tell us about Impetigo. I just like saying it.
Okay, so for Impetigo, it is a highly contagious bacterial infection that causes red sores around the mouth, nose, and skin folds. So like the axilla. Sorry if I pronounce this wrong, but there's two types of bacteria: Staphylococci and Streptococci,
Yeah.
I believe.
Staphylococcus.
Yeah.
Yeah.
It is more common around hot and humid areas or wet and dry seasons. It really just depends, but it can be everywhere. Impetigo mainly affects infants and children from ages 2 to 5, but it does affect people from all ages. People with scabies are also at increased risk due to cuts and scrapes being exposed. The main symptom is
sores rupture and ooze for a few days and then forms like a yellow brown crust around it. It can become itchy, which is it's where the hand contact isn't ideal. So like either handshaking, hugs, anything like that. It spreads by skin to skin contact or contaminated objects like bed linens, things like that. It does resolve within days to weeks depending on the severity. If for massaging, it isn't ideal to massage that. It does spread on skin. It just says right here that you can avoid it along with, or you can avoid it along with the hands since they probably have touched it or itched it. But you can massage their hands with disposable gloves if needed. Um, it definitely relates to massage because we are having skin to skin contact almost every day, and we want to make sure we don't catch it since it is highly contagious. Um, I tried to find more information on it too, with like people that aren't infants, but a lot of it was talking about how it mostly affects infants.
Yeah, I agree.
Yeah, and it's because kids don't necessarily wash their hands every so often and everything like that. So.
Well done. Thank you. Thank you. Thank you. Yeah, I've never seen Impetigo on a client. I've only seen it on infants, and they weren't clients. So it's very unlikely you'll see it. It is highly contagious, by the way. So even if the client touches their face and then you touch the client's hand, this is why we always think about washing our hands before we touch a client, right? That's the nice thing to do. But don't forget to wash your hands after you touch a client. Because almost all of this stuff, even if you touched it, as long as you washed your hands afterwards, you'd be fine. So well done, but it is very contagious, and you probably won't ever see it. Except like some of you might have seen it on your own child when they're a little baby because it's so contagious and stuff, but you won't see it. Won't see it on a client, I don't think. Awesome. Thank you. Mr. Godot, you are going to tell us about lice.
Yes.
I am ready, sir.
So, I was gonna do a PowerPoint, but looking up those pictures is very disgusting, so I didn't continue with that.
All right.
But basically, lice is a parasite that lives externally on warm-blooded hosts with over 5,000 different species of wingless insects. It not only affects humans, but birds and various mammals as well. Lice is so small that it's basically impossible to see with the naked eye. So basically, you'll feel it before you ever see it. It usually starts out as a tickle or an itch on the scalp, and then lice also it feeds on the blood. So basically, lice can't survive without like a human head. So there's different types of lice, and basically, it feeds on our blood through tarsals and claws that hook to like hair follicles, and it's also has a spine as well. So there's 6 legs, and there's a bunch of claws and spines on each of those. What I thought was interesting is they can't jump or fly, so it's like transferred through direct contact with infected person. And human species of lice cannot survive on another species. So like there's 5,000 different types. So gorillas have their own type of lice, birds, humans, and I did not know that, but human lice can't survive on gorilla lice and vice versa. And then for treatment, common insecticides won't cure lice. Or the eggs that may have been planted, because basically the eggs kind of glue to your individual strands of hair and then hatch from that point. So treatment is usually combing through the hair thoroughly with a special comb as well as tea tree oil. But yeah, so it's possible to remove it. But like I said, they can't survive without like a warm human head. So if you get them off your head, then they will eventually die out.
Perfect. Thank you, Mr. Godot. Is it a contraindication? Can we massage people with lice?
Yeah, but I wouldn't do a head massage. Like I wouldn't personally. But.
Yeah. So that's almost a trick question. The answer is yes and no. So the answer is, by the way, you can massage somebody with lice. It doesn't hurt them, doesn't hurt you. You probably won't even get the lice. The problem is having somebody with lice in your establishment. Because they not only get into the sheets, they get into the carpet and everything. We had a lice outbreak at the school at Deer Valley. And, you know, if it gets into a massage room and a cosmetology room and stuff, it's really tricky to deal with. It's not dangerous. It's just they're little bugs and they're really hard to get rid of. So unfortunately, you need, you know, if you're massaging your client's scalp and you notice that, you need to be like, hey, I'm so sorry, but we need to end the session. Again, you don't want to freak them out, right? They feel bad already, but if you notice that, they need to leave and you need to burn the building and build a new one. No, but you do need to like wash. I would actually throw away those sheets because they're pretty sturdy little bugs, and vacuum the area around it and all that kind of stuff. But it's not like they're going to leap onto you all of a sudden. Another little thing too, I just want to let you guys know, lice is not associated with being dirty. In fact, strangely enough, lice loves clean hair. It doesn't like hair when people don't wash it. They like nice, clean places to lay their eggs. So it is, people always feel dirty when they have lice and stuff like that. Has nothing to do with hygiene. In fact, bad hygiene might help prevent lice. So, and if any of you have had kids, I am sure that you've had some run-in with lice or lice at school or something. It just runs rampant with that kind of stuff. They're a hardy little bug. Doesn't mean anything. They're a pain in the neck. You got to comb out all the eggs. You got to get rid of all the lice. You have to wash everything in the house, and you have to repeat again. But that's it. So it's a general contraindication because you don't want the person in your establishment spreading these and getting into the carpet. But there's no danger. There's no true danger. Thank you, thank you, thank you. Miss Green. Thank you, Mr. Craven. Miss Green, will you please tell us about psoriasis? Are you there, Miss Green? Do I see you there? Hold on, maybe we've lost you. Oh no, you're there. Miss Green, can you hear me? Are you panicking? All right, we will check back with you later. Miss Hendrickson. Miss Hendrickson, will you want to tell us? Yeah,
I'm here. Sorry, I'm sorry. I couldn't figure out how to let this thing get off of mute, but I'm here.
Okay, Miss Green. Miss Green, will you please be so kind as to tell us about psoriasis?
Yes. Okay. So psoriasis is a non-infectious chronic inflammatory skin condition that basically often spreads to an accelerated amount, like a lot. It gets big, I guess. So the areas that are usually affected is the scalp, the skin, over the elbows, knees, back, chest, and buttocks. And it may spread to your nails, causing pitting, discoloration, and nail separation. How it who it affects, or how many it affects, it's like a 1 to 3% in the U.S. population, and usually between the ages of 10 to 30 or 57 to 60 is when it usually will happen. Psoriasis is marked by periods of exacerbation. Stress and psychosocial stress are usual examples of what causes psoriasis or can cause it. Arthritis does develop in about 30% of people with psoriasis, usually more severe cases. And psoriasis comes from weakened or impaired immune response. And then risk factors, it could be from genetics, the environment you're in, systematic inflammation, and then some things for massaging. Before massaging the affected area, you want to first obviously receive consent from them that it's okay. And then also, after they say it's okay, you want to ask them how sensitive the area is so that you can adjust pressure, as you go. And since psoriasis, since it's dry skin basically, and dry skin causes you to itch, it says that it was recommended that you use a hypoallergenic lubricant, and it's more beneficial. Emotional stress is found to play a role in like starting and spreading psoriasis, and massage techniques like effleurage would be something that would promote relaxation for someone with psoriasis. Thank you.
Thank you, Miss Green. What type of contraindication is it?
I don't know.
Is it, do you know the difference between local and general contraindication? It's okay if you don't. You can say no. Okay. So local is I don't touch that local area. General is I don't do them at all. General, just avoid altogether. And there is one other one, everybody. It's called relative contraindication. Relative contraindication means you proceed with caution, and that's actually what Ms. Green's describing.
Yeah, that's what I was going to say. That probably sounds like it.
Yeah, it's well done. Thank you. It's
so relative contraindication.
Yeah, contraindication, or yes. Anyway, yes, you're right. So, and by the way, in my opinion, every massage should be a relative contraindication. You should always be kind of checking in and adjusting depending on the situation. And Ms. Green nailed it, by the way. This is a lovely little problem for me. It's not contagious. There's zero to worry about. There are times, by the way, when it becomes local contraindication because it's so bad that there's bleeding involved, and we don't touch blood.
I was gonna say that probably will happen like if you're scratching, because I know it's like an itchy thing. Like I know even with what's it called? I said it earlier, eczema.
Yes, very similar.
Like you get dry patches and then it starts to itch, and then it can get irritated where the skin looks like it's like raising, I guess, in a way, like irritated.
Yeah.
I know I get that sometimes, like on my arms. So like when I'm reading about psoriasis, I was kind of like interested because I was like, oh, it's kind of similar in a way. I mean, they're different, obviously, but kind of similar in a way. I mean, it's all dry skin.
Yes. You guys will come across this many, many times. This is one of those things that you do see all the time. It's a lovely little problem for people because it's usually put on by stress. I think, by the way, every medical problem is made worse by stress. But anyway, and then when they get the psoriasis outbreak, then they're stressed about that, so it gets worse. So you emotionally reassuring them is actually very helpful. And the massage and like, oh yeah, I see it all the time. Must be driving you crazy, huh? Don't worry about that at all. I see it all the time, right? We're just like,
I find that when you get excited about something, or not excited in a good way, but you start freaking out or panicking or scratching at something and things get worse.
Sure. Oh my gosh, yes. I couldn't agree. I couldn't agree more. I couldn't agree more. Yeah. Thank you, ma'am. Thank you. So yeah, our job, by the way, is not just to be massage therapists, right? We want people to walk out more comfortable with their body. So just kind of remember that there. I have changed, and you will too, changed people's lives by one little comment in the massage room. And that's not my ego talking. They've come out and told me that. They've come out and been like, oh, my whole life I thought that was weird. And I'm like, oh no, my God, I've seen 10,000 feet. That's not weird at all. Really? Yeah, it's not. Oh my God. I mean, the relief on their face is unbelievable. They're like, I can wear sandals? Oh yeah, you can wear sandals. I know that this one toe is longer than the other. We see that all the time. Really? They haven't seen other bodies. It's amazing. So just remember that. You can change somebody's life. I mean, this is always true. But in the massage room, it's really, really true. You can change somebody's life with one sentence. Don't forget that. Ms. Hendrickson, you're ready to go. I can tell you're going to tell us about ringworm.
Yes, I finished my sandwich, so I'm ready to go.
It's perfect.
Okay.
Perfect timing.
So ringworm, it actually is not a worm, though it's called that. It's called that because it looks like a ring. It's actually a fungus. It starts out as a little like red patch, and then if it's untreated, it will spread and it will be like a circle. So it's called ringworm, and it can be like red, scaly, raised patches of skin. If it spreads, it can have like a clear area in the middle, and then it might have like little red bumps and like pustules in the middle. It may or may not itch. Some people it doesn't. I think that might depend on how long it goes without treatment. If you get it on your head, on the scalp, it's called tinea capitis, on the scalp. And if you get it on your scalp, it's usually you'll need a prescription type of medication to deal with it. So if you find it on your body, you can usually just get an over-the-counter type of antifungal cream, just like you would for athlete's foot. It's basically the same thing, but on a different part of the body. It tends to like non-hairy areas of the body, and like all fungus, it likes warm, moist environments. So it might be more common like in the elbows and things like that. It can happen on anyone. It's more common in children and more common in men than women. And it can be spread from human to human, from animal to human, from contaminated objects to human, and from the soil. So especially common in children who play in sandboxes and play in the dirt a lot, they can get it that way. So as spreading, it has an incubation period of about 4 to 10 days before you'll have any symptoms. And it is, let's see, prevention, you want to not share personal items like combs, socks, and things like that. That could have it on it. For massage, it would be a local contraindication. So you don't want to massage that area because it is highly infectious, contagious. And also you don't want to touch their hands because it's pretty common that they might have touched it and it could be on their hands. So you could either use disposable gloves, or you could massage that through the sheet. And yeah, so if you don't get it treated right away, it can spread and go to different areas. So they might just have it in one spot, or it could be on different areas of the body, especially if you scratch it and touch it in different areas. So you can first get just antifungal cream, or if not, then you'll have to go see a doctor, and then you might have to take a medicine, which could last for 1 to 3 months, depending on how severe it is. That you might have to take pills for like up to 3 months to get rid of it if it's really bad.
Yeah.
And that's about it.
That's perfect. Ringworm is contagious. It's a local contraindication. You guys, again, probably won't see it. Clients don't usually come to you when they have these things, thank God. I have had a client once come before that had a really small case of it, and they had a big bandage over the area. And I was like, yeah, we're cool. So it's just unlikely you'll see it, but it's a fungal infection. By the way, just so you guys all know, fungal infections like athlete's foot, ringworm, those are mushrooms. That's fungus. I love mushrooms, so I don't mind the comparison. But they're amazing. They like warm, wet areas and stuff. So we're kind of lucky to be living in a fairly dry climate. That helps right away. One of the keys is keep stuff clean and dry. And don't be afraid if you get hot and sweaty, but the whole idea is that you shower and get dry eventually. That's not a constant state for you and stuff. Yep, well done. Thank you. Let's see, where are we moving to next? Mr. Jones. Oh my gosh, Mr. Jones is going to...
It's the time everybody's been waiting for.
We have, Mr. Jones. I didn't want to be rude to all these other people, but I was like, when's Mr. Jones coming on? Sir, you are going to be telling us about scabies, as you kind of gave us a little, preview of coming attractions and your gratitude, but take it away, sir.
Yes, so scabies They are also considered itch mites, is another name for them, and they are parasitic mites that burrow underneath your skin. They are microscopic, so you cannot see them with the naked eye, and common areas that scabies like to hide are between fingers, the crease of the wrist, elbows and knees, waistline, the axilla under the breast, the lower buttocks, groin, and feet. So pretty much everywhere. They are highly contagious. You do not want scabies on you, or else you're going to have a fun time getting rid of them. And the most common transmission is actually sexual contact, so they are considered somewhat of an STD, but they can be transferred without sexual contact as well. So you can get scabies from another person, or you can get them just from a towel or a sheet or anything really that they can cling to. They are an absolute contraindication. If someone has scabies, you do not massage them, and you probably want them to leave quickly, but be polite, obviously. But you don't want them touching really any of the stuff that you use for massages. And you want to postpone the massage until the scabies are eradicated. And if you have an outbreak in your office, you're going to have to clean everything. Absolutely everything.
Well done, sir. Thank you. And he's absolutely right. By the way, for those of you that don't know, he said an absolute contraindication, which is absolutely correct. An absolute contraindication is the exact same as a general contraindication. They're interchangeable words. Different places use different things, but absolute and general contraindication. Absolutely don't do it. General contraindication, don't generally do anything. And scabies is that way. The problem with scabies is you can't really tell if somebody's got it. And so...
And I thought about that. That's the worst part. They could have no idea.
Well, they usually know because they're itching and stuff like that.
Yeah, exactly. Symptom-wise, they should have an idea.
Symptom-wise, we hope they have an idea by the time they get on your table. But yeah, there's not a lot you can do. It'd be more. I envision more of a situation where they're laying on their table and they're like, "Yeah, I just found out I had scabies. I hope that's not a problem." And you go, "It's a problem." And you go, "I love you, but I need you to kind of get up and go. I'm not going to charge you for this session. We'll rebook once you're better because it's treated with cream and lotion. And it does work and stuff, but you can't do the massage." Anyway, perfect. Thank you. Let's see, Miss Lee. Miss Lee, you're going to tell us about scars, I believe.
Yes.
Okay.
Mark collect on damaged skin or other tissues. After it is healed, damage may result from trauma, birth, surgery, or disease. Right?
Yes.
Oh, okay.
Yeah. No,
I'm done.
You're done? Okay. Well, I have a question for you. I liked it short and sweet. So scars do come from damage and things like that, but can we massage them?
I think yes, we can.
Yeah. So essentially, she's right. Scars, by the way, everybody, could be a local contraindication, and they could be nothing. If they are a fully healed scar, you can massage them all day long. In fact, some people go to get their scars massaged and actually broken up and kind of smoothed out. If you guys have ever heard of keloids, those are raised scars. And if they're massaged vigorously and then rubbed out and stuff like that, over time they smooth out. They won't go away completely, but they smooth out and look a lot better. So some people will come to you for that reason. And essentially a scar is some tear in the skin, some break in the skin where your body built it back up with extra collagen to make the area stronger. Yeah. Thank you, Miss Lee. Oh.
Okay, thank you.
Mr. Bose, please.
Isn't it true that, like, if you get them surgically removed, that they'll grow back? Because that's what my doctor told me. Because I had them after I got my appendix removed. And I was like, if I keloid, like, can you take them off?
You can take them off. I disagree with your doctor, although I'm not a doctor, and here I am talking. But here's the part that is true. Every time they make a cut to remove a scar, there's going to be some type of scar from that cut. But if you're talking about removing a keloid that's this big, like you've got this, I've never seen your scar, I don't mean you personally, but let's say you've got this nasty scar you don't like, they could definitely cut it out and make it a much tinier scar, especially a plastic surgeon, because they'll stitch it really carefully. They'll have a much tinier scar. But that is the problem, by the way. Every time you cut the body, you usually create a scar. Yeah. But yeah, they can remove, yeah, heck yeah, they can. Your doctor just didn't want to do it. And maybe your doctor couldn't do it, but a good plastic surgeon could, yes. Mr. Lee. Wow, that's a mouthful. Seborrheic dermatitis, Mr. Lee.
Okay. Let me try to read this.
Yes, please do. Try. I know it's tough, sir, but try. Try.
All right. Let me try. Seborrheic dermatitis, chronic inflammatory condition of sebaceous glands marked by increase in amount of changes in quality of their secretions.
Good. I'm sorry, were you pausing or are you done, sir?
I'm done, sir.
Okay. So, I just have a question about it. Can we massage it?
I think so.
Yeah. Seborrheic dermatitis, yeah, he's right, basically. Basically, if it's not irritated, seborrheic dermatitis is really, it's a super common condition, everybody. And it usually affects people's scalps. And it causes, like, you'll see like little scaly patches and red skin and dandruff and things like that. Sometimes you'll see on their body too, but again, if it's not really bothering them and it's not bothering you to rub it, it's not something you really have to worry about at all. It's got a big, long, fancy name, but it's not dangerous. Maybe a relative contraindication, if that helps. Okay. I want to make sure. Let's see. Mr. Ma, you have shingles. Well, you don't have shingles, but you're going to tell us about shingles. There's a big difference. I've had shingles. Yeah.
Okay. So my presentation today has two parts.
Okay.
The first one is I have tried to recite the information from the textbook, and I hope I can speak out without looking the book.
Okay.
I hope I can do it. Yeah.
Yeah. You don't have to do all of it. Yeah. Let's see.
Okay. So the shingles is an acute, localized viral inflammation of the skin. Kind of nervous already.
Well, first sentence was excellent.
Yeah. So it is essentially reactivation of the chicken pox or herpes zoster virus. After the chicken pox has resolved, the virus lay dormant within the sensory spinal nerve roots and is kept inactive by the healthy immune responses. However, if the immune response becomes weakened or is suppressed, the virus travels down dermaton, which leads to the disease manifestation. So the distribution of the delisters is usually unilateral, typically affecting the thoracic area and sometimes the face. Although occasionally the both sides of the body may be involved. The shingles are very common, with between 600,000 to 1 million cases is the shingle are adults older than 50 years of age, or who are in the community suppressed, such as people who having the diabetes, right? Or the positive for HIV, and are taking immune medications, immune suppressed communications.
Yeah. Immunosuppressant medications. I don't blame you for not being able to say that. That's like three hard words.
Under the extreme psychosocial stress. Yeah. And this is what I get from the textbook. And right now I want to read some information from online.
Okay. That was already fantastic. You keep going.
Yeah. This is around the symptom and what kind of situation we need to see the doctor immediately. So for the symptoms, the signs and the symptoms of shingles usually affect only a small section of one side of your body. Those signs and symptoms may include pain, burning, numbness, or tingling. Sensitivity to touch, a red rash that begins a few days after pain, fluid-filled blisters that break open and cross over, itching. And some people also experience fever, headache, sensitivity to light, fatigue. Pain is usually the first symptom of shingles. For some, it can be intense, depending on the location of the pain. It can sometimes be mistaken for a symptom of a problem affecting the heart, lungs, or kidneys. Some people experience shingles pain without ever developing the rash. So most commonly, the shingles rash develops as a strip or of blisters that wraps around either the left or the right side of your dorsal. Sometimes the shingles rash occurs around one eye or on one side of the neck or face. So the next thing is telling when is the best time to see the doctor. The pain and rash occur near an eye. If left untreated, this infection can lead to permanent eye damage. And the second is you are 60 or older, because age significantly increase your risk of complications. And the next is you or someone in your family had weakened immune system. And the last one is the rash is widespread and painful. So this is everything I learned today, and but I'm not sure if this is a local contraindication. So this question I want to ask Mr. Tapscott.
Well, I'm just waiting for your fans to quit clapping, sir. You've got a big cheer section there. You might want to bring a pen to lab later, because some people might want your autograph, because you're kind of famous now. That was fantastic. More than enough information, sir, truly. I'll answer that question in 1 second. I just want to highlight what you said this. I am just repeating what you said and summarizing. I'm not adding a single bit to it. You said all this. Shingles are really the chickenpox virus. Once you've had chickenpox, you lovely have that virus in your body for the rest of your life. It lives in your nervous system. Those wires from your brain to the rest of the body, it lives there, and a good, strong immune system keeps it in check. But in general, when your immune system gets run down, or you get stressed, which runs down your immune system, I hope you guys have heard that, by the way. Stress seems to lead to an awful lot of stuff. It can pop up. it is most definitely a local contraindication because it's highly infectious. Most people, when they get shingles, if they go to the doctor, they actually tell them not to go out for a few days until they're not infectious anymore. So if they really just got shingles, it'd probably be even an absolute or general contraindication. But definitely it's a local, you don't touch the shingles. And for some people it's painful, for some people it's not. And it does sometimes show up in little strips on their body because it's following the nervous system actually going around their body and stuff. But you're dead on accurate, sir. At the bare minimum, though, it's a local contraindication. Bare minimum, local contraindication. And like I got shingles once, and by the way, you can get it over and over again. But it showed up as the size of a quarter on my shoulder and didn't really hurt. And they just said, don't go out for a couple days, and then you put a pad over it, and you're done. But some people get it much more widespread. I got very lucky. Thank you, sir. That was good. That was really good.
Thanks so much.
That was really, really, really good. You need to take that in. I'm telling you. That was really good. Like Mr. Craven said very kindly, so I will repeat it because he already said it. Mr. Craven read his all off of a pad, and he's been speaking English his whole life. Kind of. He's kind of speaking English. But anyway, and you did great. Jeez. Pat yourself on the back. Way to go. Okay, Mr. Manzanares, you are going to tell us about stretch marks. And I can't wait. Hello, sir. You're fine. You're fine.
So what are stretch marks? Stretch marks are also called strias, meaning grooves. Some are like red marks, red streaks that appear usually, but change color after time, turning white or silverish, and reduce the thickness of the skin. And the location. They're usually located in the breast area, the upper arms, thighs, abdomen, hips and back, and also appear in any area where fat is stored. And there are many causes of stretch marks. One is caused by muscle growth or rapid growth of weight gain. Also, heredity occurs, usually like in blonde or redhead. And diet as well, when there's like a lack of vitamin C and zinc. And there are treatments, but they're only good to reduce and minimize the appearance of them. And work best when they're treated in the early stage of stretch marks when they're red. And yes, you can massage the area and may help reduce the appearance. And it's a relative contraindication.
Anything else, sir? There doesn't need to be. I'm just asking.
What was that?
I said anything else, sir? There doesn't need to be. You covered it, but I was just asking. I don't want to cut you off.
That's all. Sorry.
Yeah, don't be sorry. That was excellent. That's actually exactly all. That's all there is to say about stretch marks. They really are, by the way, usually a rapid weight gain. I've seen it in three situations. You see it with pregnancy, right? Rapid weight gain because you're growing a baby. You see it with rapid weight gain if somebody is overeating or whatever. You see it also in bodybuilders sometimes with steroid use where the muscle's growing so fast the skin can't keep up. And I've seen all those on my table. Relative contraindication is really the perfect thing to say about it. They're not really endangerment at all. And, by the way, massage helps prevent them from forming. So in pregnancy massage, helping rub the belly, and not in a deep fashion at all, helps to keep the skin supple and elastic and helps it not stretch. And rubbing existing stretch marks tends to minimize their appearance. They won't go away, but it minimizes their appearance. Yes. Ms. Hendrickson, you raised your hand.
Yeah, I think it can also happen when someone grows, like just has a growth spurt.
Sorry, absolutely. I apologize for that too. Yeah, any type, but that's kind of a rapid weight gain too. But you're absolutely right. Rapid changes in the body. So people go through puberty and they put on weight and get curves cortisol, this kind of stuff, and all of a sudden, stretch marks, right? For the rest of your life. Welcome. Yeah. Anyway, so that can happen too. Absolutely. Any other? Yes, Ms. Carrillo, please.
It can happen during weight loss too, right? Like rapid weight loss?
I haven't seen, I'm no expert, but I have not seen that. What I've seen in rapid weight loss sometimes is some people's skin, a lot of people when they lose weight, their skin just kind of shrinks back in, right, with them. Some people when they lose weight really fast, there's leftover skin. And I haven't seen stretch marks, I've seen leftover skin. So, where the skin hasn't kind of pulled back in along with them. Yeah. I've only seen that in really rapid weight loss, but I have seen it. Yeah. Okay. Miss Osuna. You there?
I'm here.
Excellent. Miss Osuna, can you tell us about warts?
Yes, sorry, my mouth is still very numb, so if you guys can't understand me, just let me know and I'll repeat myself.
You don't sound like your mouth is numb, so that's good. You don't sound drunk. You're good.
So warts are oval-shaped, rough, and raised mass of skin all over the body. They can occur typically anywhere, honestly, but is tended to be on the hands, feet, face, legs, and genitals. That's where they're most likely and commonly seen. They can just grow one wart at a time, or they can grow in like patches or groups. They are super contagious. So they are spread by the contact of this infection and this area. The cause is the human papillomavirus, which is HPV, which that can cause the genital warts or cervical cancer if it does get to that degree. Given that they are very contagious, it's to avoid the area as much as possible. Then they typically do not spread through the linens, so it's not 100% necessary to wash them after being in contact with that client, but it is beneficial to wash them after they leave.
Beautiful. Beautiful. Well said. So essentially a local contraindication. By the way, I presented the slide that you sent me, Miss Osuna. I don't know if you saw that. Thank you. So let me stop presenting. Hold on. There we go. Yeah, warts are a local contraindication. By the way, they get in through a break in the skin. So this is the nice thing about massage, not only washing your hands, but the fact that we use a lubricant, an oil. If you've got no breaks in the skin and you've got oil over your skin, it's actually a very good barrier to all this stuff. So it's when you have a break in the skin and they have a break in the skin that things tend to get into you. So if you don't have a break in your skin and you've got oil on it on top of that, you're fine. It's not a big deal in and of itself, but it is a local contraindication. You'd avoid them if you see them. That's it. You guys are going to be freaked out after today's presentations. Yes. Okay. Well done. Thank you. That leads us to Mr. Do we have time? Yes, we do. Mr. Overman, will you tell us, just review the bones, joints, and movements of the shoulder girdle complex with us?
Yes, I will. And I apologize for the unprofessionalness. My internet is not working on my computer, so I'm having to improvise here.
It's pretty good improvisation. Yeah, you're doing great.
All right. So the shoulder girdle complex consists of three bones. You have the clavicle, as you see here, highlighted there. Then below that, you have, not exactly below, but over here you have the humerus. And then if we flip this guy around here with one of these buttons, I swear I was prepared at one point. Oh yeah, here we go.
Hey, you're doing good.
Here we go. Then in the back here you have the third bone, which is the clavicle. I'm sorry, the scapula. And then joints, you have here where the clavicle meets the sternum, you have the sternoclavicular. Then where the acromion meets clavicle, you have the acromioclavicular. And down here, you have the glenohumeral joint. All of these have their own movements. Let's see if we can go through them a little bit. If not, I'll just flip the camera around and do them myself. So with the glenohumeral joint, we have the ability to flex and, I'm sorry, we have the ability to flex and extend. Then, let's see what this button does. We have the ability to abduct and adduct. And see what this button does. Okay, this is our rotations. You got a medial rotation there and a lateral rotation. Bring that back. Then if we bring our arm back up to, if we flex it back up, then we have a horizontal, wrong button. Let's try this one. Second, yeah. All right, then we have a horizontal, no, we're not going to get it anyway. We have a horizontal abduction and a horizontal adduction, bringing it back into the body.
Nice.
Now if we flip around here, wrong button again, we'll get it. Flip around here to the scapula. It has, I'm going to turn it around because I can't show you on this. So with the scapula, it has a upward rotation, meaning the acromion turns up. This being my acromion in this example. We have a elevation, depression going down. Then we have coming away from the spine this way would be a abduction / protraction. Coming back into the spine would be a adduction / retraction. I believe that is everything.
Yeah.
Sorry about the professionalness here.
Everybody loved your skeletal thing, sir. That was amazing, and you covered exactly everything I asked you to cover. That was fantastic. That was fantastic. I love the program too. I love that we can actually see the medial and lateral rotation we've been talking about for so long. Thank you, sir.
You're welcome.
Wow, you guys are making me look bad. Okay, Miss Pugh, will you just explain the origins, insertions, and actions of Latissimus dorsi and teres major?
Yes, the origin of the Latissimus dorsi is the spinous process, ribs 9 through 12, posterior iliac crest, that's posterior sacrum, and the insertion is an intertubular groove of the humerus, and the actions extends the humerus, medially rotates the humerus, and adducts the humerus. And then it's pretty much the same for the teres major. The origin is inferior third of the lateral corner of the scapula. And the insertion is an intertubular groove of the humerus. And the actions extends the humerus, medially rotates the humerus, and adducts the humerus.
Nice. One question for you only. How many of the actions of Latissimus dorsi are exactly the same as the actions of the teres major?
All of them.
Thank you! Done. One and done. Cool. Miss Rader, will you please tell us about the deltoids and the trapezius? O's, I's, and A's.
Right. Hold on.
No problem.
Can you see my screen?
No.
Oh.
Sorry.
Still no?
Hold on. No, still no.
Oh. Let's try it again.
Yeah, take your time.
Not, and I'll,
Yeah, we'll figure it out. It's our first day.
This would share your whole thing. I want to show this one. Okay, you can share your whole screen and then switch to that.
That's a thought.
And then click, hold on. Okay, right here, right? Yeah. And down. Okay. And then you click that. Instant. Cool.
are sharing. I love it.
Yay.
Beautiful.
Okay. So I'll make this quick because obviously this is a review because we've already done the deltoid and trapezius muscles. So about the deltoid, it is a triangular shaped muscle located at the cap of your shoulder. It's divided into 3 sections. You've got the anterior fibers, which are in the front part of the shoulder, the posterior fibers in the back of the shoulder, and the middle fibers. Sometimes people call them the lateral fiber because they're kind of off to the side. The origin of the deltoid is the lateral 1/3 of the clavicle, the acromion, and the spine of the scapula, and it inserts into the deltoid tuberosity, which is located on the humerus. Just for a visual of that, you've got the anterior, medial, posterior deltoid. It originates up here, and the insertion down here on the humerus. Let's see here. The actions of the deltoid, so all of the fibers of the deltoid will abduct the shoulder, so moving it away from the body. The anterior fibers, you flex the shoulder, medially rotate the shoulder, and horizontally abduct the shoulder. And then the posterior fibers do the opposite action, so they extend the shoulder, laterally rotate the shoulder, and horizontally abduct the shoulder. Actions of the deltoid is just some examples. Basically anything that you do with your shoulder is going to engage the deltoid. So obviously there's exercises that do that, raking the yard, using your shoulder, rowing a boat, putting on your jacket. All of those things will engage the deltoid. In the trapezius, it lies superficially along the upper back and neck. And of course, all the fibers are easy to palpate because they're superficial. They also are divided into 3 groups: the upper fibers, middle fibers, and lower fibers. The origin of the trapezius is the external occipital protuberance, medial portion of the superior nuchal line of the occiput, the ligamentum nuchae, and spinous processes of C7 through T12. And the insertion of the trapezius is identical to the origin of the deltoid, which is the lateral 1/3 of the clavicle, acromion, and spine of the scapula. Here's another visual of that. Again, upper, middle, lower, and the insertion. So basically it runs from the base of the neck all the way down to last thoracic vertebrae. Let's see here. Uh-oh, lost my thing here. Actions. Bilaterally, the trapezius extends the head and neck. Unilaterally, it will laterally flex the head and neck to the same side. It will also rotate the head and neck to the opposite side. It can elevate the scapula and upwardly rotate the scapula. The middle fibers abduct the scapula and stabilize the scapula. Help stabilize the scapula, I should say. The lower fibers of the trapezius depress the scapula and upwardly rotate the scapula.
Beautiful.
And more examples of that. When you pull your shoulders back, kind of like in the military position, you can see on this woman down here, you're engaging the trapezius, carrying a backpack over your shoulder, riding a bike, sticking your neck out over the handlebars, or if you're like me, when you're sitting here leaning forward trying to look at your computer screen because you can't see it, you're engaging the trapezius. But that is it for the deltoids and the trapezius.
Beautiful.
1 minute over, sorry.
No, that was beautiful. All right, everybody. That, by the way, Ms. Rader, I'm not just saying this, that was way better than my presentation on the deltoids and trapezius. I felt that, by the way, about both the reviews. That was ridiculous. I'm embarrassed, but I'm happy and embarrassed. I like being shown up by my students. Thank you. I can't even add to it. It was absolutely perfect. For those of you who didn't get to go today, I know you are deeply saddened, and we will start out the class with you tomorrow. I wouldn't want you to miss out on your opportunity for fame. I will see all of you in lab Thank you, thank you, thank you. I will write notes on your presentation, all that kind of stuff. You'll see them in your canvas. Thanks, everybody. If you have a question, yeah, please stay on. Miss Green, please.
So do we have homework today?
We do have homework today. I am not in my homework screen. Let's see. Hold on. I'll tell you in 1 second here. Come on. Thank you for asking, by the way.
Thank you.
I mean, well.
Thought it would be nice to know.
I don't blame you. Yes, you have a test of the integumentary system and a video on rotator cuffs. So 15 and 16 you'll see in your assignments.
Okay, thank you.
Thank you for asking. Anybody else? Was that the question that I was going to get from somebody else? Mr. Craven, I think, probably. Yeah. Okay, sorry. You'll see him pop up here in a second. Mr. Manzanares, were you going to ask something, sir?
Yeah, I was just going to be an hour late to let you know.
Okay. Thank you, sir.
And I was going to make up the time for Monday today, and then for the hour I'll make it up Monday.
Okay. All right, so you're going to stay today, is that what you're saying?
So I'm going to stay today the 3 hours for the lab for Monday.
Oh.
Today.
But you're going to be late today.
Yeah.
But you're going to stay an hour late.
For the hour for today, I'm going to make it up the next Monday.
Just come and we'll talk about it when you're here.
Okay.
Thank you, sir. Thank you. Bye-bye. All right, anybody else? Oh my gosh, let's see. Jeez. Open the door. Yes. Hey. What's up, Buttercup? Yeah, I just didn't want to stop the whole class to look at your hours. So, well, I haven't looked at them yet. I can't look past like last week until they update them.
The hours that I was missing.
How are you getting to school now?
My girlfriend.
Ah, okay.
Sometimes she picks me up. Sometimes
Gotcha.
my mom drops me off. Sometimes
Okay.
I just take her car.
All right. Anyway, I'll check them. Unless you missed a lot of hours, you should have an awful lot of hours now.
I had missed. You said I had missed 6 and a quarter.
Okay.
And then
You should have a lot by now. Yeah. I'll check it out and try to give you a guesstimate. But I hate to tell you, it may be a week into your externship that I don't know your exact hours.
Okay.
I'm sorry.
That's fine.
But we'll know. But my guesstimation would be they'd be fine now.
Okay. Thank you.
Yeah. Thank you, sir. Hi, buddy. I'm going live on I don't mind that you're in here. I'm just letting you know I'm going live on a meeting. No, it just started. It's fine.
This time and day works great for me, but we're the people who are here. So we might not be capturing the perspective of the people for whom this time is not a good one. But yeah, I'm good with it.
And the bulk of the team is here, so that's a good thing, right? The bulk of this group is here. We also wanted to talk about the frequency. So as we're all working in our individual work groups, obviously there's not always going to be something to report out once a month or once a week or whatever that might be. So having some of that bigger time frame to actually work with your work groups and get those projects and resources and things put together might be more advantageous to have those to be weekly or monthly or bi-weekly